Good evening, everybody. Let's keep in mind today and always that our client is in the center of our circle of care and that their participation is integral in every decision that we make. Today we saw Kayla. She's from a large refugee family that recently came to Canada from Syria, and she came to our clinic today with her parents, Ali and Asma. She's 6 years old and hasn't been feeling well for 2 days. She came in with a fever of 37.9 degrees and a sore throat, which they tried Panadol for. I noticed that her cheeks were flush and her lips looked dry, and her tonsils looked red and enlarged. I also noticed that she has a strabismus, dark circles under her eyes, and she seemed a little small for her age. She has quite a few dental caries that I noticed, and she continually rocked back and forth during the interview without making any eye contact with anybody else in the room. When I tried to begin a physical exam, Kayla became upset, and I got the impression from her parents that she doesn't like to be touched. Details were difficult to establish because of the language barrier, so I managed to contact a phone interpreter, and they were able to help me understand the goals that Kayla and her parents had for her care. I also explained to them who I hoped to have involved in the process, and that each healthcare professional had their own important role in the bigger picture. I also made sure to get consent from both Kayla and her parents, and I topped off the interview with a sticker.
Today we have a client, Kayla, who came to our clinic. After Dr. Lam's examination, I connected the family with an interpreter who will be available in person for all future healthcare appointments. So let's prioritize.
Dr. Lam completed a rapid strep test, which showed that she has strep throat. I helped her parents pick up her ampicillin prescription, and we gave her the first dose in clinic to watch for possible reactions.
I think it's important that we learn about how long Kayla's had her strabismus. I'd be pretty concerned if it was acute, and if so, I'd like to get some imaging done. If it's not new, it may have been due to congenital rubella, but regardless, I'd like to make sure we refer Kayla to an ophthalmologist so we can fix her strabismus now before it progresses to an amblyopia. I'm also wondering about her behavior. What do you think, clinical psych?
I'm concerned about potential trauma, and because of Kayla's age and difficulty speaking English, I will take a mixed methods approach to the assessment. I will start with observing how she interacts with toys to get some clues as to what she may have experienced. I will then conduct a clinical interview and verbally administer the trauma symptom checklist for children. If trauma is ruled out, I will assess for autism with the ADOS. For treatment, we want to make sure that Kayla feels safe. I will work with Kayla and her family using a combination of trauma-focused cognitive behavioral therapy and narrative exposure therapy with a focus on drawing rather than writing.
With all the cavities that I saw in Kayla's mouth, it's important that she sees a dentist to have them looked after. I also need to ask Kayla's parents if she's always been small for her age. We need to monitor her growth to make sure that she's progressing well and she continues to do so. If not, we might think about referring to a dietitian to make sure that she's eating well. Finally, we can't assume anything about the vaccinations that Kayla and her family may or may not have, so we need to get them all involved in a catch-up vaccination schedule as per Nova Scotia's guidelines.
I will connect Kayla and her family to resources in Halifax to help her transition to Canada. This includes both local families and refugee families. I will also connect them with some resources for school.
There are 4 main challenges that we've identified while working with Kayla and her family. First, Kayla's social challenges include that she speaks limited English and has recently moved to a new country, which could impact her available social support network. Additionally, her avoidant behavior might impact her health, social, and educational well-being. To combat these challenges, we will enlist the help of an interpreter. Additionally, we will be culturally sensitive and will not make assumptions about values. Further, our social worker and psychologist will help Kayla and her family identify resources and peer supports. If needed, we will also refer to an occupational therapist for school support.
Second, Kayla's medical challenges include that we do not have her medical records, and she is currently not communicating her health concerns with the team. She also does not like to be touched. To address these challenges, we will adapt our approaches and use creative problem solving to meet Kayla's needs. As we cannot make assumptions about her medical history, we will start an immunization record for her and be cautious with her medical care.
Third, Kayla's financial challenges are unknown. Since we are registered under the Interim Federal Health Program, the only medical funding concern would be for referrals, in which case pro bono work can be explored. If needed, our social worker will collaborate with Kayla and her family to identify funding sources for any needs.
Last, working interprofessionally has many challenges and rewards. We all individually contribute to Kayla's well-being, but work most effectively when we collaborate as a team. Kayla has a lot of presenting concerns. One challenge our team has is to prioritize our care plan and ensure that we are not overwhelming Kayla and her family. We also need to recognize potential system constraints, such as wait times, that might impact Kayla's care. In addition, when working with children, there can be a tendency to speak with the parents or interpreter and not to the child. Keeping Kayla at the center of our care plan and involving her throughout the process enables us to ensure a client-centered relationship.
To conclude, I think we can all appreciate how many things there is to consider in this case. But the most important thing to remember is that we keep Kata and her family at the center of our care.